Now we're going to talk about the parathyroid glands. There are usually 4 parathyroid glands, and they are located in and around the thyroid gland. They appear as small brown or black bean-sized pieces of tissue, and sometimes they appear very similar to the thyroid tissue itself, and it's difficult to distinguish the two. But the parathyroid glands secrete parathyroid hormone. And parathyroid hormone is the master of calcium regulation. The parathyroids are not controlled by the anterior pituitary gland. The parathyroid hormone raises blood calcium levels by stimulating the bone metabolism of calcium. Calcitonin is made by the thyroid gland, and it prevents breakdown of bone, and it's used to treat osteoporosis. So if we can remember, calcitonin means calcium in the bones. So the parathyroid glands secrete parathyroid hormone, and parathyroid hormone is the master of calcium regulation. So parathyroid removal during a thyroidectomy can cause parathyroid hormone deficiency, which may result in decreased serum calcium levels. Decreased calcium levels in the body can cause skeletal muscle dysfunction, spasm and pain, smooth muscle dysfunction including dysphagia or swallowing difficulties, nerve dysfunction including tingling and numbness, and loss of parathyroid glands can also cause cardiac arrhythmias due to the decreased calcium levels. Decreased calcium can cause tetany, and tetany is defined as skeletal muscle dysfunction, spasm and pain, nerve dysfunction including tingling and numbness. So nursing considerations in the post-thyroidectomy patient. We want to observe for tetany during the first few days after thyroidectomy. Remember, this is spasm, pain, numbness, or tingling, and this can indicate parathyroid damage. Treatment for this would be to give the patient some calcium gluconate. A partial thyroidectomy or subtotal thyroidectomy is removal of around 90% of the thyroid gland. This can initially cause hypothyroidism, and the remaining thyroid tissue may grow and over time fully return to its function of making thyroid hormones. So in a partial thyroidectomy, thyroid hormone replacement therapy is withheld, and this is to allow the thyroid to regenerate and begin working again on its own. We will also want to teach patients and families to reduce their caloric intake to prevent weight gain, because initially the patient will be hypothyroid. We also want the patient to avoid goitrogens. These are foods that contain substances that affect the thyroid gland. We want to teach that exercise will help stimulate the thyroid gland, and that follow-up care will be necessary to determine whether or not the patient will require lifelong thyroid hormone replacement therapy.